Do you know if your body is having problems reproducing blood cells? If so, chances are it could be leukemia, a cancer caused by the problem of producing blood cells. Leukemia is a cancer of the bone marrow. Bone marrow produces the blood cells in our bodies. Leukemia occurs when the bone marrow is having trouble doing its job in the body. If the cancer is caught quickly, it can be treated. We can catch the cancer quickly by knowing the signs and symptoms of the disease. While leukemia can be treated, it can also be fatal in many cases. According to the American Cancer Society, there are many types and forms of leukemia. There is acute myeloid leukemia, acute lymphocytic leukemia, chronic lymphocytic leukemia, chronic myeloid leukemia, and the rare hairy cells leukemia. Acute myeloid leukemia is the most common form of leukemia. Acute myeloid leukemia builds blast cells that don't form mature cells. When these immature cells form, white blood cells then form, and they cannot fight off infections. Acute lymphocytic leukemia is a form that progresses more rapidly in the body. Acute lymphocytic leukemia replaces the healthy cells with the leukemia cells. These leukemia cells don't mature properly. Chronic lymphocytic leukemia is a slower development of the cancer and has a higher survival rate than most forms of leukemia. 83% of patients meet the 5-year survival rate with this form of leukemia. It first starts when the bone marrow extends to the blood and eventually spreads all over the body into other organs, like lymph nodes. When the cancer spreads, it crowds the normal blood cells, making it difficult to fight infections. Imagine you're a kid with the flu, you go to the doctors, you get an antibiotic, and you're cured after a few days, maybe a few weeks, or however long it takes you to get the antibiotic in you. For a patient with leukemia, this doesn't happen. The antibiotic won't help its body at all. Its body physically can't fight off the infection. There is also the chronic myeloid leukemia. That affects the bone marrow and the blood. It starts in the blood-forming cells and then slowly spreads on through the body. And the rarest form of this cancer is the hairy cell leukemia, a type of leukemia that forms from chronic lymphocytic leukemia. The cancer slowly develops when too many white blood cells are produced. Each form of leukemia comes with similar symptoms: bruising, pale skin, fatigue, sore muscles, and even swollen lymph nodes and bloody noses. A doctor can determine your treatment from your diagnosis depending on your symptoms. Most treatment plans for leukemia consist of chemotherapy, blood transfusions, radiation, bone marrow transplants, and stem cell transplants. Along with treatments and the cancer comes risks. According to the Mayo Clinic, leukemia has medical risks, life risks, and there are also risks of getting leukemia. Leukemia has medical risks of death, other forms of leukemia occurring, and even genetic disorders in the body. The life risks of leukemia include hair loss, extreme fatigue, problems exercising, and muscle loss. One of the risks of getting leukemia includes age. Patients usually 55 and over experience leukemia, and 20% of patients under the age of 15 are at high risk of getting leukemia. Smoking can also increase the risk of leukemia. About 3,600 smokers are diagnosed with leukemia a year. Patients with Down syndrome are also at high risk of getting leukemia. And according to the National Institutes of Health, if one is affected by leukemia, it is likely they will forever be. About 20% of leukemia patients have recurring symptoms and the disease reoccurs in their body. If someone is treated and cleared of leukemia, it can reoccur in the patient. Leukemia is a cancer that kills and takes almost 58,000 people a year, and is a major cause of death in our world. Most people don't know this, but if we catch the cancer faster than normal, then the cancer would never spread through the rest of our body.